hemorrhoidectomy is a surgery performed to remove hemorrhoids. And your doctor may recommend it if your hemorrhoids do not respond to a more conservative treatment. Hemorrhoids, also known as piles, are swollen veins that appear on the surface of the rectum or anal canal. A swollen vein near the entrance of the anal canal is called the external hemorrhoid, while a swollen vein inside the rectum is called an internal hemorrhoid. Internal hemorrhoids are classified according to their level of development. First-degree internal hemorrhoids are those that always remain inside the rectum. Second-degree internal hemorrhoids expand outside the rectum during defecation and then automatically return inside the rectum. Third-degree internal hemorrhoids extend outside the rectum during bowel movements and then must be pushed back into the rectum. And fourth-degree internal hemorrhoids always remain outside the rectum and cannot be pushed in. Some of the causes of this condition are constant constipation, chronic diarrhea, lifting excessive weight, pregnancy, obesity, excessive effort when defecating. Before the hemorrhoidectomy, it is possible that the patient gets local or general anesthesia. If general anesthesia is given, he will receive drugs to sleep through an oxygen mask or intravenously, and later a breathing tube will be inserted through the mouth and into the trachea. It will help him breathe during surgery. Once the patient is asleep, he will be placed in the lithotomy, razor, or lateral position to immediately begin to disinfect the perineum and anus. The doctor will begin by using a scalpel, electrocautery, or laser to make an incision in the tissue surrounding the hemorrhoid to expose the swollen vein. The specialist can tie off the swollen vein to prevent it from bleeding when it is removed. Once this is done, the doctor will extract the swollen vein and the inflamed tissue, and depending on the case, he will evaluate if the wound can be left open or should be sutured. Finally, medicated bandages will be placed on the wound to help it heal and protect it from infection. Generally, this procedure lasts about an hour, and after surgery, the breathing tube is removed and the patient will be asked to eat a high-fiber diet, as well as to drink plenty of fluids to avoid constipation during recovery, which can last between 2 weeks to 2 months approximately. The doctor may recommend warm baths, medications, or laxatives to make the patient more comfortable in the days after their procedure. Most people who undergo this surgery can go home the same day of the procedure. However, in some cases, the patient may stay a day or two in the hospital. Likewise, it is important that if there are side effects such as fever, excessive pain, wound drainage, redness, or swelling, the patient must contact their doctor immediately. Hemorrhoids are an extremely common problem that must be treated on time to avoid complications.